Hi, let us read about acute tracheobronchitis. Acute tracheobronchitis, an acute inflammation of the mucous membranes of the trachea and the bronchial tree, often follows infection of the upper respiratory tract. A patient with viral infection has decreased resistance and can readily develop a secondary bacterial infection. Thus, adequate treatment of upper respiratory tract infection is one of the major factors in the prevention of acute bronchitis. Aside from infection, inhalation of physical and chemical irritants, gases, and other air contaminants can also cause acute bronchial irritation. Pathophysiology. In acute tracheobronchitis, the inflamed mucosa of the bronchi produces mucopurulent sputum, often in response to Streptococcus pneumoniae, Haemophilus influenza, and Mycoplasma pneumoniae. In addition, a fungal infection, example Aspergillus tracheobronchitis, may also cause tracheobronchitis. A sputum culture is essential to identify the specific positive organism. Clinical manifestations. Initially, the patient has a dry, irritating cough and expectorates a scanty amount of mucoid sputum. The patient complains of sternal soreness from coughing and has fever or chills and night sweats, headache and general malaise. As the infection progresses, the patient may have shortness of breath, have noisy inspiration and expiration, that is inspiratory stridor and expiratory wheeze, and produce purulent pus-filled sputum. With severe tracheobronchitis, blood-streaked secretions may be expectorated as a result of irritation of the mucus of the airways. Medical management. Antibiotic treatment may be indicated depending on the symptoms, sputum purulence, and results of sputum culture. Antihistamines are not prescribed because it may cause excessive drying and make secretions more difficult to expectorate. Expectorants may be prescribed. Fluid intake is increased to thin the viscous and tenacious secretions. Suctioning and bronchoscopy may be needed to remove secretions. Rarely, endotracheal intubation may be required in cases of acute tracheobronchitis leading to acute respiratory failure. This may be necessary for patients who are severely debilitated and who have coexisting diseases that also impair the respiratory system. Treatment of tracheobronchitis is largely symptomatic. The patient is advised to rest. Increasing the vapor pressure, moisture content in the air will reduce the irritation. Cool vapor therapy or steam inhalations may help to relieve laryngeal and tracheal irritation. Moist heat to the chest may relieve the soreness and pain. Mild analgesics or antipyretics may be indicated. Nursing management. Acute tracheobronchitis is frequently treated in the home setting. A primary nursing function is to encourage bronchial hygiene, such as increasing fluid intake and directed coughing to remove secretions. The nurse should encourage and assist the patient to sit up frequently, to cough effectively, and to prevent retention of mucopurulent sputum. If the patient is treated with antibiotics for an underlying infection, it is important to emphasize the need to complete the full course of antibiotics prescribed. Fatigue is a consequence of tracheobronchitis. Therefore, the nurse must caution the patient against overexertion, which can induce a relapse or exacerbation of the infection. Thank you.